Hey everyone, we're Talistock and we're super excited to show you what we've been doing. So I'm Roshan.
I'm Sukesh.
I'm Ashwin.
I'm Rajat, and we're 4 students at Yale University interested in making healthcare more accessible.
The amount of elective procedures around the world has significantly decreased because of COVID-19. So as a result, doctors who are not seeing COVID-19 patients have less high work throughput and more free time. Meanwhile, Africa has a quarter of the global disease burden, but only 2% of the world's doctors. There's over 2 million healthcare workers needed than what is currently there. Our platform connects physicians to patients in Africa. Essentially, doctors can diagnose and treat non-acute patients via telemedicine, which is the best alternative that currently exists to provide essential health services. Moreover, Talistock will help alleviate congestion in developing countries' healthcare systems by allowing their doctors to focus on high-priority cases. This way, nobody gets left behind. The application we developed is entirely self-contained. Everything needed for a high-quality telemedic experience and virtual clinic setting to a patient is integrated into our platform. This includes EHRs, the appointment scheduling system, instant messaging boards, and comprehensive patient profiles. Pretty much everything a patient getting quality health service in the US would have. A critical component of Talistock is its accessibility. Doctors can reliably communicate with patients across continents with our secure, in-browser, video call WebSocket. Talistock also integrates speech-to-text synthesis and translation modalities to break the language barriers, allowing American physicians to talk to Swahili patients. All content on our site can be translated and spoken aloud to those who can't understand or read English. Language barrier is broken.
Introducing Talistock. I'm going to run through a demo of the full experience of Talistock. Talistock connects doctors who serve to patients in need. Disease does not know boundaries, so why should medicine? This is our app's landing page. Here are some facts about the problem at hand, and here's some information that we use to inform users of our initiative. One big thing about our application is we wanted to make it accessible. We did this in 2 ways. The first one was through VoiceOver. Essentially, a user can select any part of our website, such as
Africa has 25% of the world's disease and 2% of the world's doctors,
and we'll read it out loud. This will help with people who have trouble with reading and literacy. Another thing we wanted to do was we wanted to break language barriers. So we translated our site to multiple languages, including Swahili and French. VoiceOver also is enabled in this format.
Mettons-nous au travail.
Now let's walk through an experience.
So Docusign's e-signature API service was actually essential to making our platform both reliable and safe. And so this we'll see in 2 ways today. One we'll see when signing up as a doctor, and where you are contractually obliged to provide correct information, just making the system more robust overall. So let me show you how to sign up as a doctor. So let's say my name is Frank Burt, and I can choose a doctor to sign up. So this will relay me to another sign up page where I'll have to enter more specific information about my medical practice. So this will then route me to the Docusign API e-signature link, where I'll have to sign my name on a contract that essentially obliges me to provide the correct information. And so this is, essential to making sure that our platform is secure and that the people registering as doctors are actually doctors. So here we see the doctor landing page. So here we see the landing page for our doctors, and Once again, we're trying to go for a very simple approach here. So we have just the card showing upcoming appointments where they've been matched
Upcoming appointments.
with patients to see. Also, we have the ability to speak out certain elements once again to try breaking down that language and communication barrier. We'll also see some back information of the doctor, previous patients they've had, as well as their expertise. So general profile information of a doctor should be ready to present at a moment's notice. So one of the things that one of the key things to a doctor's ability to volunteer is, of course, when they're available. And so a doctor will be able to select the dates they're available on this calendar UI. So let's say that today, 31st, they're available from like 7 to 7:30 a.m. We'll just save that. And so this will be saved on their own user account. Let's say since September is coming up, they know when they're available. We'll say like September 9th from 11:30 to 12. We also add a few more times. Maybe they know they'll be available from 12 to 12:30, and so we'll save times here. So then these will be saved, and they'll be used when a patient now tries to schedule an appointment, which we'll show next. So now I'm going to show the sign-in, sign-up flow for a patient. So they normally go in and sign up to make a new account. I already have an account made, so I'm just going to log into that. Then we will input some characteristics and medical info. So here's the profile page. Here are some of the characteristics and previous doctors you've had, medical history. So one of the things we really believe is that a patient should be able to get instant feedback on a diagnosis. And so for that, we've included an AI diagnosis system in which a patient can input some symptoms they've been experiencing, and then they can click diagnose, which will input to a pre-trained model to make an estimated diagnosis based on their symptoms. So yeah, this seems pretty severe, so let's go find an expert. Of course, they can put in times they're available. Let's pretend that it wasn't a heart attack, so they are available in a week or so, September 9th, and let's say from like 11:30, just to match up with our doctor, so you can see how this works. I forget exactly what time it was. So we'll put in these, and they can schedule an appointment, and hopefully we'll pair up with Dr. Burt. Great. So of course, we really hope that the platform will be able to emulate a normal doctor-patient interaction. So a doctor and a patient will be able to reach out to their doctor, even if it's not a scheduled appointment date. And so we built a messaging platform to let us do that. So here's some message history from Dr. Burt. Pain and some slight dizziness. And so this will route to the doctor's messaging platform, which we'll check in a minute. So one of the other nice things we've added for a patient is the ability to send over sensitive EHRs, electronic health records. And so this is another place where Docusign's API was critical to our platform, specifically in making sure our site's reliable. And so when you click submit, this will route to the Docusign e-signature API link, where here as a patient, I'll have to confirm that the sensitive information I'm requesting to send over to my doctor is the doctor I want it to, so I'll put in the name of the doctor to make sure whoever I'm sending it to is who I want to send it to, and also that I understand that this information is going to be sent over to someone who already doesn't know about it. So let me just go ahead and sign it for now. Maybe this is a CT scan for some EHR, that's part of some EHR. After I finish this, it will be sent over to the doctor, and they'll be able to get it, check on it, and it will link back to the profile page. Okay, so now let's go ahead and check out the doctor side of things to respond to messages and prepare for the meeting. So pairing up with Dr. Burt is what I wanted. As you saw, I inputted some of the free times Dr. Burt had in the beginning of the video, and so this is how our algorithm works. So we developed an algorithm that will essentially find the best pair between patients and doctors based on when they're available. And so this is all running in the back end, and that's why specifically I wanted to put in September 9th, because that's when we also put in for Dr. Burt. Okay, so I've come back to Dr. Burt's profile page, and here we see that her new appointment has come up for September 9th at 11:30. So one of the things a doctor can do is respond to messages patients have sent. So let's respond to our message we sent a bit earlier. Get some rest, and let's talk on the 9th when I can take a better look. So this will send over back to the patient. So of course, a doctor can get a full queue of all the patients that are supposed to be scheduled for them. And so the reason why we added this is so that the doctor can, based on the symptoms, rank which patient should be seen first, depending on how severe a symptom is. Because our backend algorithm takes into account an estimated severity, but of course it can't replace that human touch a doctor is able to bring. So let's now go ahead and introduce how to actually make the call and perform telemedicine. So when it comes time for Dr. Burt to visit her patient, she can go to her profile page and click the Join Video Chat button to connect to the secure and in-browser video chat service that TelesDoc provides. Similarly, when it comes time for the patient to meet with their doctor, they can go to their profile page, go to the upcoming appointments card, and click the Join Video Chat. So one of the things we tried emphasizing with TelesDoc is easy accessibility, and this of course entails seamless communication between the patient and the doctor. So one of the ways we tried combating this is by integrating speech-to-text synthesis with real-time translation. So for example, if the doctor wanted to talk to the patient, they could speak into the microphone. So, I hear you have a lot of back pain. Would you still like me to prescribe you that medicine we talked about last week? Of course, they can always change the language depending on what language the patient speaks to translate. So, for example, if they speak Swahili, you can translate it. Or maybe French. If you would like me to prescribe the medicine, I can get it to you by the end of this week.